Welcome to Skinside Out, where we uncover the science, trends, and truths behind skin health. Your trusted guide to the world of dermatology. This podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional.
Welcome to Skinside Out, where science meets beauty. I'm your host, Dr. Zain, with Heather, Courtney, and a new face here today, Nurse Wendy. So since Nurse Wendy is new, let's have her introduce herself.
My name is Wendy. I've been the nurse at Dermatology for about 2 years now. I've been a nurse for a long time. I'm a mom of 3, grandmother to 7 wonderful little girls, and 1 boy.
She's not old enough to be a grandmother.
I am. I have a really good dermatologist. Kind of head up the wellness department at NOR, and we do some wellness IVs. We do some wellness injections. We also do a little bit of semaglutide, things like that.
She's also kind of like our office mom. She takes care of all of us.
She does.
She's the wise one who kind of gives us good advice to take. She also makes sure that we're well fed.
Not only us, but our plants too.
Oh yeah, all of our office plants would be dead without her. And her husband's really cool too.
Yeah.
I love this. All right, so as we're exploring the world of wellness, I thought it would be really cool to have an episode talking about what we can do to help enhance our health, not only our skin, but also just our well-being, our psychosocial health.
Yeah, so to break it down today, we'll talk about the incredible benefits of antioxidants, IV hydration, lifestyle medicine and its play on skin health, as well as the ever-evolving world of wellness.
All right, so let's get right into it. So let's talk about antioxidants and how that can help our skin.
Right. Antioxidants play a crucial role in protecting our skin and our body from environmental stressors like UV rays, pollutions, anything in the environment that we come into contact with that can harm us.
Yeah, and they're really fighting off free radicals, which are unstable molecules that can cause skin aging or skin damage.
So antioxidants come in all different forms. Some are topicals, some are going to be supplements that you take. Through our food is another way that we're able to get those, which is probably the best way to get the antioxidants. It's usually better absorbed than through supplements.
So let's talk about some key antioxidants that can help with your skin.
So vitamin C plays a big role. It reduces the appearance of fine lines and wrinkles, supports collagen production. It also can brighten the skin, help improve hyperpigmentation and even the skin tone, and also overall enhance your skin's appearance.
Yeah, so I mean, taking oral vitamin C is really good for our health, but is it the same as topical application of vitamin C serums?
Not necessarily. Ideally, you want both a topical vitamin C, ideally in the morning, as well as supplementing vitamin C through your food and diet.
And in dermatology, I mean, vitamin C is one of those cofactors that is required for producing collagen. That's why it's so important for our skin integrity and health.
Another antioxidant that we're seeing a lot in the dermatology world is NAD. So that is going to be...
Courtney, what does NAD stand for?
Heather, what does NAD stand for?
Nicotinamide adenosine dinucleotide.
Say that 4 times fast. So NAD is a coenzyme that has been essential in essentially repairing DNA, damaged DNA, energy production, as well as maintaining cellular health.
And another one that's pretty popular and well known is B12. People come in for B12 injections. You can have B12 insert. B12 is an additive in all our IVs, but it helps in red blood cell production. It helps support your DNA synthesis, your skin cell turnover. It helps promote regeneration of skin cells, and it's just overall for your well-being and health for many things to deal with in your body.
Yeah, and it's funny. Whenever I've gotten B12 shots, I feel incredible afterwards, but a lot of people say it's placebo. What are your thoughts on that?
Well, I mean, just on my own personal level, I mean, I usually get one at least once or twice a month.
Yeah.
I mean, it helps me sleep better. I feel more energized, and just overall my well-being is better. So I don't think it's a placebo effect.
Yeah,
I think it really does help.
I do think so. Yeah.
Especially if you don't eat meat a lot. Vitamin B12 is found in soil that animals eat. And that's how a lot of people who eat meat get their vitamin B12. And so if you are vegetarian, vegan, or if you're kind of low on the meat intake, it's definitely worth supplementing or getting injections.
And people with B12 deficiencies, I mean, they can definitely benefit from it.
Anemia is a real disorder, and so we can help that.
Yeah. So let's talk about glutathione. So this is another antioxidant that's pretty hot. So this also reduces oxidative stress throughout the body. And what's interesting with its tie with dermatology is that, especially in Asia, we're seeing a lot of glutathione being used to help improve skin health, appearance, especially the tone. So in Asia, especially like in Southeast Asia and South Asia as well, glutathiones are actually being used to help lighten skin, which, is controversial. And, I think that it can help to an extent, but I don't think it's the right treatment specifically to kind of improve, skin pigmentation from that standpoint. And also like the use of like bleaching creams constantly, which is rampant in South Asia because everyone wants to look lighter. Don't get me started on that. We'll talk about another podcast about these colonial like psychology that's been, imparted onto the people. So
those 4 antioxidants are the biggest ones that we wanted to touch on. That's something that we actually offered these in our office, but there are other antioxidants that can help improve skin health. There's vitamin E, beta carotene, selenium, copper, zinc, and CoQ10, just to name a few.
Many of these vitamins can be injected into muscle, subcutaneous tissue, but it can also be administered through IV. So let's talk about IV hydration and what benefits that can play.
IV hydration is kind of the new up and up thing right now. So, IVs typically in the past were for illnesses or sickness, if you're feeling bad, or to treat you. So now the curve is wellness, so preventative things. So how can you feel better from the inside out? And the nutrients that we absorb through food, they have to go through your stomach, or the supplements, and they go through your stomach acid. And a lot of them are destroyed before they can even get in your bloodstream. So IV therapy, it's straight into your bloodstream. It's on a cellular level, so you're getting those nutrients right away. It's usually minimally painful, a small little prick. We asked you some questions beforehand. Make sure you don't have any contraindications that would keep you from getting any of these additives or the wellness IVs. But yeah, it's a great way to start feeling better immediately.
Yeah.
Yeah, that's the nice part is the, direct effect that it has on the bloodstream. You're able to feel those benefits much quicker rather than, building up, let's say through food or through supplements, and having to keep it in the body for longer.
Yeah, and it's, good to keep in mind too that this is not something that's curative. It's created to supplement or assist in your overall well-being, support the body's natural process for healing. And so IV hydration can definitely be a valuable additive to your routine.
So let's not forget also that, yes, these are key vitamins and antioxidants that we're putting in, but the main ingredient in that bag is water. And water is really helpful for our body to function properly. So, people are just constantly dehydrated. I'm one of those people. I don't drink enough water. I need to work on that. But it's one of those things that tends to be underestimated, like how much better you can feel when you're absolutely well hydrated.
Yeah.
So,
Yeah. What are we, 80% water? Our cells function on water.
Everything
crosses the blood barrier through water. So, water is life.
Yeah. And it flushes out toxins, right? So it's needed for all those processes in our body. So, we see a lot of these benefits, and we want to be at the forefront of providing our patients with, the best care possible. So we recently introduced a lot of these IV therapies in our office. And I know that some people aren't believers of these therapies, but I do think that they do help. And, we have specific combinations that we give to patients to provide a specific result. So let's go into those.
Yeah. So one that's super popular for us, we deal with skin, its appearance, it's the inner glow. And these are made at a certified compound pharmacy in Florida. been around for years. The additives are very pure. They're all made in America. They all have specific dates on them, and they're in sealed containers. So there's not a whole lot of handling in office because this is going directly in your bloodstream. It needs to be sterile. But our Inner Glow package works for helping with your skin, your hair, and your nails. It has a complete vitamin complex that helps with cell turnover, but it also has biotin. Biotin, it's controversial whether or not it really helps. It's a protein, so it isn't going to hurt you, but it's got a big boost of biotin in it that's in your bloodstream. A lot of people have added that for coming in for alopecia, acne, overall just healing.
Nails.
Nails, growing nails, stuff like that. But it's fairly popular, especially with us in our practice.
Mm-hmm.
Another one we offer is the Get Up and Glow. So that one is a B complex, and it also has some essential amino acids in there. So this is going to be a great one for energy. I like doing that like before the weekend, especially if I have like a lot of plans going on. It just gives you that little extra boost to kind of feel more energized and just feel healthier and better, and you like want to get stuff done. And it also can help support muscle recovery too. So it's a good one if, you're working out at the gym and maybe you went a little bit harder than normal, come in, get an IV and just help recover.
Yeah. A lot of our patients are in the process of their weight loss journeys. They're trying to lose fat, become more fit, improve their lifestyle. And we have an IV therapy called the Slim and Shine. I like that. To kind of help them along with that process. So this IV specifically contains B complex, L-taurine, methylcobalamin, and this actually helps enhance fat metabolism. So it's really helping, you to lose more weight in a safe manner, whether you're doing it just through diet and exercise or using some help, such as like semaglutide or any other GLP-1s. So that can be very helpful.
Yeah. And lastly, we have our fourth IV, which is the Myers cocktail. And we decided not to name this one on the same trend as like the Glow and the Shine, because Myers cocktail is very well known as that classic IV. It's full of magnesium chloride, B complex vitamins, B12, calcium gluconate, and ascorbic acid. And so it has this well-rounded option to support your general health, reduce stress, and manage fatigue.
Yeah, and this is the one that I really like for those patients that are feeling run down, they're feeling tired, maybe getting over some viral illness. So let's go.
Like you were back in November.
Yeah, so after Thanksgiving.
Tell us about your personal experience.
Yeah, so after Thanksgiving, probably had a little too much to eat and got a viral infection, and it was not fun, throwing up, diarrhea, all that jazz. And honestly, being the martyr that I am, I trucked into work, kept seeing all my patients, but I was feeling awful. Like, I don't know how I functioned that week.
I've never seen you so pale.
Oh my God.
On saltines and
that's what. Yeah, like my staff was literally keeping me alive, getting Pedialyte, saltines, and because literally I could not keep anything down, and I was just feeling awful, really, really bad. So, Wendy, being our office mama, she came and hooked me up with this IV, and honestly, I felt so much better. Yeah. So much better. I feel like I was definitely dehydrated. I mean, I lost 10 pounds in a week.
Yeah.
And I was just able to just get over it. And I think by the next day, like I was really kicking it. And I was doing much better. So I think that helped my recovery. I should have done it probably sooner.
Yeah. Yes.
Don't we have a video of it?
Yeah, I don't even think it was the next day. I think the same day he's walking into the break room for snacks. We got to play the video.
Oh my God, guys. You
I was off that day and Courtney texted that to me and I had such a good time watching that. Wendy, didn't you say that typically when somebody is getting an IV, if they're getting a full bag, they have to go to the bathroom in the middle of it or anything? But Dr. Zain was so dehydrated that he didn't even have to stop.
Yeah, I don't even think and I gave him 1,000 cc's
and you
too.
ran the bag.
Yeah, right? I gave him the whole bag. It went wide open.
Yeah, wide open.
He was so dehydrated. It was just sucking everything.
But, I got 5-star treatment. So when you hooked me up,
literally,
to the IV, I had a pillow, I had my blanket, lights off, and I felt better.
Yeah.
The cool part too about the IVs just in general is because you see how seamless it is, you can also pair them with things like, red light therapy or other treatments,
And I do
facials,
that,
things
yeah.
like that.
Do we have a
So-
patient who was combining some of her laser treatments while getting an IV simultaneously?
Yep, yeah.
Talk about multitasking.
Yes.
Yeah. And you can add those antioxidants to the IVs. So like that glutathione, the B12, NAD, you can always add that as a booster.
Yep. And I have several patients that get the Myers cocktail. They have a history of migraines, and magnesium is known to help with that, with nerve function and everything. And so they really like it a lot. And I mean, it seems to help. It's a very well-rounded mix.
I think that we should move on to the next piece, which is lifestyle, which I think is so important in helping you achieve not only a healthier skin, but just a healthier life. So let's go into some of the 6 pillars of lifestyle medicine.
Yeah, so the American College of Lifestyle Medicine has deemed 6 pillars of what entails lifestyle medicine. Courtney made me shorten this section, but I think it is so important. Anyway,
Some of us are avoiding pillars.
The 6 pillars of lifestyle medicine are nutrition, physical activity, stress management, avoiding risky substances, and having restorative sleep.
This is all the stuff that your primary care doctor will go over at your,
Or Heather.
Or Heather at your yearly exams.
You want to go into them?
Yeah,
individually?
so nutrition, just making sure you have a balanced, nutrient-rich diet that can really help support the skin. I think the skin is like a window into the body, and so if you're healthy on the inside through diet, you can, show that through your skin too.
Yeah, physical activity, we know what it does for our bodies, but what does it do for our skin? So it really helps us to, it helps to deliver blood, which carries oxygen to our skin, so for it to function. It expels toxins. It helps with lymphatic drainage. So a lot of great benefits that we can see.
Stress management for sure, which I think we all could use a little help on. So stress can definitely influence a lot of different conditions on the skin, including acne, rosacea, psoriasis, eczema. So trying to limit your stress and find ways of, practicing mindfulness. I know Heather's really into yoga. I need to get back into it. Finding your outlet and what works for you.
Yeah, and tying in with physical activity, the release of endorphins can really make you feel good. It's like your own body's antidepressant.
Yeah, kill 2 birds, 1 stone.
And another thing we need to do is avoid harmful toxins, putting things into our body that we know is not going to help us. Tobacco, alcohol, just avoiding environments that are smoggy and just full of toxins.
Yeah.
Restorative sleep. Sleep really helps to repair and regenerate skin cells. It helps to regulate cortisol levels as well as supporting collagen production for the skin.
Yeah, I feel like this last year I became a real stickler about my sleep schedule. Like I am in bed by 10 o'clock and then I wake up,
It's because you're old now, you're 30.
I know, yeah. Well, yeah, for background, I did turn 30 in October and it changed everything. So yeah.
Now she understands what we go through.
Yeah.
Right.
The 6th one I forgot to mention earlier, but social connection. Courtney, do you want to touch on that one?
Yeah, because I'm so social.
She is. She's a social butterfly.
Yes.
Making sure you have a strong support system, I think, is always really important. Maintaining social connections, just to essentially help your psychological well-being, which in turn, I think when you have a healthier psychological well-being, it contributes to other factors like maintaining things like the physical activity, doing your skincare routine, things like that, reducing stress. That also helps, you go out with your friends, have a nice dinner, are able to unload a little bit. So making sure you're having strong support systems, I think, is incredibly important.
Yeah, and that's actually has been found in scientific studies. Like social connection is probably the highest correlation with longevity. So in health. So I do think that there is a very powerful portion of our lives that's tied to that social connection that we have. We're social beings. That's what we are.
Yeah.
Well, I remember in psych, we had watched a video about these monkeys that were given the option of water, or it was this toy that was supposed to be their mom. It was a bigger monkey toy. And almost every time the monkeys would choose the mom figure, like the connection over the water, which as we all know, we need water to live.
Yeah.
But I think it just goes to show how strong that need is, that those animals were still choosing to have that connection over a basic need.
I've got a family, I've got, my wife and 3 kids, and I love that connection. We have our friends. But another big part of my life is my work life and my work family. And honestly, I couldn't imagine a better team of people to be around. And, we rely on each other. We get along really well. And it really does help my mental well-being just being around you guys.
Aww.
Aw.
Well, I was joking with Heather. We all went on a staff trip last weekend, and then we're doing some more things together this weekend. So I made a joke with Heather recently. I'm glad I like you guys because we spend a lot of time together.
And I think we've all been in jobs where we did not like our coworkers and toxicity, and it's just such a refreshing and rare chance that we have to work with each other. I mean, sometimes we deal with difficult patients, difficult situations, difficult diagnoses, but we kind of have each other and we can help support each other, especially also when we're going through stuff personally. We have each other to pick each other up. So I do think that social connection is so important. And, a lot of people are miserable at their jobs and also at home, and it really does take a toll on your mental health, and that affects your physical health.
Yep. Yeah, exactly.
All right, so after that warm and fuzzy discussion, we've got a lot of different options that we have to help unlock our potentials with wellness. But there's some new stuff that is being introduced, and I think it's really cool how dermatology is kind of like the face of these new innovations. We're able to deliver a lot of new treatments and cutting-edge innovations based on science to help improve our skin health. So some of the newer things that we're being able to introduce directly to the skin, PRP, PRF, we have the salmon sperm, the PDRNs. Heather, what does that stand for? Polydeoxyribonucleotides.
Let me check my polydeoxyribonucleotide fraction. I didn't have that one memorized.
Growth factors, and also using light therapies to help improve skin health. So let's talk about exosomes. So that's a pretty hot topic in dermatology and regenerative medicine. So what exosomes really are these small little vesicles, are these little enveloped carriers of signaling molecules that can help stimulate biological processes and cause protein synthesis and other changes in our skin and as well as other cells. So it's pretty interesting that it can be actually applied to the skin and actually lead to skin changes. So that's something that I think is pretty cool.
Yeah, PRF also we've been using a lot and seeing a lot recently. So that stands for platelet-rich fibrin, which is different than platelet-rich plasma. The PRF is going to be a more concentrated version of your growth factor. So very similar to the PRP, we do draw your blood. We spit it in the centrifuge, but we also use heat to essentially coagulate it instead of adding the anticoagulant like we do with the PRP, which can actually burn upon injection. So if you've ever had, PRP in the scalp, you might have noticed that burning sensation, and you don't get that with the PRF. So it's just a more concentrated version of those growth factors that can help essentially restore the skin, restore the growth factors, and build collagen.
Yeah. And it releases it slowly over time. So you're still seeing the results of it as, those growth factors are being released. So it does stimulate your own collagen production, which is really cool.
And I think people are using it more in place of filler, which is really interesting. So key points really under the under eyes, sometimes in the cheek area, just temples, those areas that are losing volume, we're able to replenish naturally.
Yeah. And it's a great option for patients who either don't want to do filler or are scared about it. This is derived from your own body, and it does work very well.
Mm-hmm.
Yeah, and there are ways to get it into that gel form, so it's kind of acting like that filler.
It's pretty low risk, too, at any adverse reaction.
Yeah, you don't have to worry about the vascular occlusion like you can get with filler, necrosis, migration, things that we do look at when we are injecting filler.
Yeah. So let's talk about PDRNs, polydeoxyribonucleotides.
Yes.
All right.
Okay, salmon sperm.
Derived from salmon sperm. So that's where it's derived from. It's not salmon sperm itself.
It's more fun if you say.
I know, right? I think I got that buzz when, I think Kim Kardashian.
Haley
really,
Bieber's been posting about it a lot too recently. So
yeah, so it's all the rage. It's been around in Korea for a while, as are most things beauty. But what these are small pieces of ribonucleotides. So they're like genetic material that are like broken down into small pieces, and they are like growth factors, and they kind of induce these cellular changes, help for like tissue regeneration. So that's how it helps. It induces collagen synthesis and just improves the appearance of skin when it's applied topically.
Next, we have growth factors and peptides. So growth factors are naturally occurring proteins that play a critical role in the body's healing process. They can trigger cellular regeneration, repair cellular tissues, or repair tissues, and improve the function of skin as well as hair. Peptides also help stimulate the production of collagen and elastin. And I like to describe the differences between collagen and elastin. So think of it like a mattress. So collagen is the stuffing of the mattress, and elastin is the spring of the mattress. And so,
I like that.
yeah, you can, there are ways to, bring some of that back or produce more of it. Typically, like your classic filler will help kind of replace that collagen, that stuffing. But there are other ways to stimulate those as well.
So would a waterbed kind of be like hyaluronic acid?
That I don't know. So when we introduce growth factors into the body, whether it's through exosomes, PRF, or PDRNs, salmon sperm, we're essentially accelerating that body's natural healing process. And there are other, products that you can use topically that can complement any sort of injections. So my favorite topical growth factors are, I've got 3 in mind. So Neocutis, their eye cream called Lumiere. Their bioserum from Neocutis as well. And then the Skin Medica TNS is also great.
Yeah, and those products, I just think they're so underrated. I think so many people are used to, your vitamin C, your sunscreen, and your retinol or retinoid. And while all of those are important too, I think growth factors are just so underrated. They're a little bit pricey, but I think they're so worth the money. I get patients all the time that are like, oh, I'm so mad that you got me hooked on this because it works so well. But it's an investment.
Yeah. And it really helps to reduce inflammation, stimulate that collagen, improve tone and texture. So it's great for fine lines and wrinkles. It can also be used in the hair too for hair thinning.
And it's really well tolerated. So it's not like irritating like a lot of the retinoids are and, some of the other acids that we use topically. So patients really like it.
Yeah. And I think they're just so important post-procedure. I really love using them with microneedling or, laser treatments. I think they just really help enhance the results that you're getting from those procedures.
Yeah. Well, for healing, the red light therapy can be used in conjunction with medications like Ameluz for treating AKs and things like that. But it can also just be rejuvenating because the red light is using a specific wavelength that's either red or near infrared light, and it penetrates the skin. It helps stimulate the cells to regenerate. It decreases inflammation. We use it post-treatment when we're doing some pretty invasive things like subcision and stuff like that in the office. And it just helps calm everything down. All the, brings the body cells to the source wherever you're shining the red light, and it helps healing. It helps carry away the bad things. So it's a very painless. Feels good. It's warm. You have to wear some safety goggles, but you can have it done as quick as 10 minutes in the office. And there's many, you can get some cheap at-home things to do as well with red light.
Yeah, and it can also help supplement some of the treatments that we're doing, especially with like growth factors. So we have a treatment in the office that we do for hair loss where we're actually kind of creating these microchannels in the skin, on the scalp, or wherever you're noticing hair loss. And then we apply a growth factor serum, and then we expose that skin to red light, and that actually activates some of those growth factors and makes it a more effective process.
Yeah. Hair treatments as well, too.
I love it post-procedure. It can really cut down the healing. and really enhance the results. I love it post microneedling, some of our lasers. It really does stimulate the healing process.
And it kind of calms people down too.
It actually helps with sleep.
Yeah.
I use it in my facials. Yeah. So especially after like extractions where people might be a little red and swollen, the red light is really nice to use for those patients. So there's so much in the wellness front that it can definitely be, I think, a little confusing. So many new things that are coming out. I think all of us would agree we're pretty research driven. And so, there are things like cryotherapy, infrared saunas, these salt caves, all sorts of, all sorts of things that are marketed for wellness and overall well-being. And so while some of these, I think, is it placebo? Is it working? That's still to tell. So making sure that you're kind of following things that are backed by science, moving forward.
Yeah, I think evidence-based medicine plays a huge role, especially if your provider is following that and staying up to date on it. But I think as science and technology continues to advance, there are a lot of wellness professionals that are uncovering these new ways to help us live healthier, more vibrant lives. And while these traditional approaches like antioxidants and lifestyle changes can and are important, these new emerging treatments offer new hope for looking into different ways to rejuvenate the skin.
Yeah. I mean, I think that we live in a world where we're really prioritizing health and wellness, and it's constantly evolving. And we really need to stay at the forefront of data, science, studies, and being able to offer these treatments to our patients to help improve their lives. Everyone's looking at quality of life. And if we can, as dermatologists, improve their lives by offering them these technologies, these treatments, I think it's a win. And it's a really meaningful way to impact patients' lives. So I think offering that in a holistic environment is really good, but we're still looking at the data and the science and making sure that everything that we're recommending is really in the patient's best interest, because we see some marketing strategies that aren't really based in the science, and it's just a quick money scheme. That's not really what we're looking for. We're really trying to help your skin be the best it can be, and also improving your health at the same time. Yeah. So I think that this was a really enlightening discussion about wellness. I think that it is the future, and it would be remiss not to discuss it with our patients. So I'm really happy that we have that space in our practice to be able to discuss that with patients, and we don't brush it off. I do think it's so important. It's not just giving pills and creams. We really have to take a deeper dive and see what our patients need, what can help them, and that's what it's all about.
Agreed.
All right. So hopefully you guys enjoyed this interesting discussion for this week's podcast. And if you enjoyed it, please like us, please follow us. But until next time, Skinside Out.
Thanks for listening. This episode of Skinside Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717.